And joining me now with the latest in COVID-19 in our region is our Medical Officer of Health, Dr. Paul Roumeliotis. Welcome back, Doctor.
Good to be back, Gabriel.
All right, so let's start first of all with the 3 new orders that were issued 2 days ago.
Yes, the first order was a repeat, sort of an extended order of the one that I issued April 3rd, which was really aimed at large retailers, grocery stores, and so on, so they can have crowd control, parking control, and those type of things. And one of the things that I wanted to add, I added other retailers that potentially will open as we're getting out of it. So I wanted to include that. So that was the difference. I also had more specifics about how to screen ill staff for them as well. So it was just a tweak of that order, but also getting ready for more retailers to open as we ease the restrictions. It's not going to happen right away, but I just didn't want to rewrite the order. The other 2 orders were again in the same vein. One was for curbside pickup, and it's just basically in line with the ministry's latest guidelines that were released yesterday as to how to safely deliver goods, the curbside, discouraging cash transactions, preferring, tap and pay and those type of things, and also crowd control and so on, where appropriate, depending on the business. And then the third one was really the same thing for drive-through restaurants. Again, ensuring that people don't line up, don't congregate in the parking lot, have infection control procedures. And I did it really because I wanted those to be frameworks as we roll open, into easing some of these restrictions in probably the next couple of weeks if all goes well. Then these things are already in place for us, so we can do it quickly.
And it can only be good to be ahead of the game. And 2 things I just want to touch on from that is number one, where applicable, because there was some confusion to that. Obviously, not every store is the same, as well as the preference for tap. It's not that cash is completely prohibited.
Well, I'll tell you, if you look at the ministry's guidelines, they want to eliminate cash. They said eliminate cash, but let's be realistic about it. However, there are creative ways that you can pay with cash. Let's say you're going to a drive-through or a curbside, pickup. You can put the cash, on your windshield. The individual picks it up and leaves. That type of thing. Puts without direct contact. Those type of things. Obviously, I think people who are receiving cash should wash their hands afterwards. Those make a lot of sense. But the trend really is it's easier, it's kind of safer, it's contactless if you do it with a tap. But I recognize that not everybody has it, so that's why I modified it a bit to be able to do that. And obviously, one size does not fit all. So the big box stores, yes, I want people outside controlling the traffic. But if you're a small little convenience store, you can actually control the traffic better just from being inside. So that's why I put if applicable, where applicable, and also discouraging cash, but also giving directions. For example, a drive-through, they have plexiglasses and so on, or take other precautions.
All right, and all of that, of course, is completely in the interest of protecting the community from the spread of COVID-19, and we're seeing a benefit of that from our numbers. So let's talk about our regional numbers right now, which are maintaining very flatly.
Well, you know what? We've flattened. It's been about a week now that we've got maybe 1 or 2 extra cases a day, with the exception of a long-term care residents. And that's why now I separated on our website. We've got 11 that are in long-term care. So you subtract it. So we're still flattening. We're still flat, but we're still getting cases. So I want people to understand that the good news is that we're flattening. I want to make sure that we continue that trend and go downwards in terms of not getting new cases. But at the same time, we should continue these measures, because the more we continue these measures, the better we'll be in a position in a couple of weeks to say, you know what, now's the time to at least start opening up.
And I think one of the best analogies I saw was you don't run back into a burning building just because the fire has stopped growing.
Exactly. You want to do it slow. You want to make sure behind you that there's no fire, right? So as we go into these measures, into easing of these measures, will allow more stores and so on, we always have to make sure that physical distancing and all these precautions are in place. So that's why I did the orders, because those precautions are always going to be in place regardless of when we open and how quickly we open, because it'll be staged, right? So I think those physical distancing, washing your hands, not going into work if you're sick, are all going to be a part of new life as we know it, moving forward.
And of course, with the understanding that we're absolutely not out of the woods yet, the health unit's website has updated its numbers as well to show resolved cases, and that's a great way to show that that light is at the end of that tunnel that we keep
Well,
alluding
yes,
to.
yes. As a matter of fact, even the provincial ones, this morning I was there, there's at least 10,000 resolved cases out of the ones that we have, which are almost like 50 or 60% of the cases. Us too, we're getting resolved cases as well, to show people that. And the other thing too is that although we still have 2 people, the other thing too is we have 2 people in the intensive care unit still, out of the cases that we've had. But the good news is that we haven't had any deaths, knock on wood, and I hope that trend continues. And secondarily, we continue not these individuals don't, most of them did not require any hospitalization. It went away on its own, and they're resolved. So that's the good news.
And of course, as we alluded to, that's all a testament to the work that we've all been doing. Of course, the cooperation of the community in terms of staying at home. So maybe we could just finish off with your message, especially now. We've alluded to it before, but with the nice weather coming, it's so important to continue what we're doing because it's working.
I know the temptation is out there to go outside and to meet other friends and so on, but you know what? We've done this now, 6 weeks, 7 weeks? Let's hang on for a couple of more weeks. We're not talking more months now, a couple more weeks. We see that light at the end of the tunnel. It's nice and sunny, and I think that we'll be able to, by the end of this month, start relaxing these things, relaxing these measures. So let's be a bit patient, but let's make sure we're still diligent collectively, and I really appreciate all the work everybody does, all the media partners, Cogeco, everybody who's supporting us getting the message out, because I think the message is being heeded, and collectively I think we've done a good job, but we need to continue.
On that note, Doctor, thank you so much for joining me for this update.
No problem.